Hey everyone, this is Dr. Owen, Advanced Physical Therapy and Wellness, and we'll be going over some kind of like test, retest stuff. Mobilization with movements for knee flexion, knee extension, all that stuff. So essentially there's a couple of different ways of doing it. And first way, the most common one is internal rotation of the tibia right in through there. So essentially you'd be kind of blocking one portion of the thigh and then coming in through here and kind of creating a twisting moment. Let's say they have pain with squats, or they're squatting down, this foot kicks out. You can do flossing techniques, or you can do this one. So go ahead and we'll go ahead and squat, and I'll just kind of hold it firmly through there, go ahead, and then back up. And oftentimes if you kind of glide that around, you can even do an anterior glide of the fibula and just do that, or you can do a combination of both. Go ahead, squat. Here's like a combo, good. So that's one way of doing it, and have them just essentially do that kind of pain-free, maybe 1 set of 10. And then go ahead and have them repeat with your hands off. Symptoms should have improved. If they get worse, then you might want to try a different technique. And then if they get better but not quite there, then maybe do another 1 or 2 rounds of 10. Okay, go ahead and relax. So that's one of them. The other one is, you got medial glide, so you can just glide in laterally on his femur up top, and then medial glide the whole knee right in through here, pushing that direction. There's also lateral glide, so going in reverse. Basically, you just have them repeat, squat, do those glides, and then if the pain reduces, then that's the glide you're going to want to go about. You can either do it with them in standing, or if they're still pretty acute and still can't quite tolerate weight bearing, you can do it with them laying in prone. So go ahead and have you lay in prone, and I'll show you those. Yep, and I'll show you the or other way, or yeah, that'll work. That's actually a better idea with the camera. Sweet. Okay, so doing medial glides or lateral glides, or I mean you can even do the rotational glides, coming right in through here and then kind of rotating with just your hands and having them bend the knee. Bend the knee, good, just like that. Or you could even assist like this. Good, that's one way. Let's do medial and lateral glides. Interestingly enough, so lateral glides I found are better with people with more knee valgus. And then medial glides, I've been noticing people with more varus they prefer. So you can essentially grab onto the belt underneath the knee here with one hand and then kind of laterally glide and then have him bend his knee up and then kind of follow with him and then add a little bit of overpressure so long as it's not painful. So you can use these techniques too on people with like that have had like surgical repairs and stuff like that. You can really get some good pain-free range of motion so long as there's no sharp pains. So that's the lateral glide. Here is medial glide. Go ahead, we'll do this knee just for the sake of the camera. We'll come right in through here. This will be medial glide. If you want to do the other knee, then I would just go on the opposite side. Coming in right in through here, just below the hips. Kind of stabilizing underneath the knee with one hand, kind of driving in on that femur to force in the opposite direction. Kind of giving it a little bit of a glide, and then go and bend the knee up. Good, and you just kind of follow a little bit of overpressure. Usually do 2 or 3 rounds of 10, holding on the 10th one. Or you could do 1 round of 20, holding on the 20th one if you're in a really big kind of pinch of time. You got a lot of ground to cover. And hold. Just like that. There are a couple others too. The knees and the elbows are kind of complicated. So we'll have you sit on up against the wall over here. We'll give you the little bolster. A couple more. So essentially you'll have anterior glide, so you can anterior glide and then have them bend the knee up. Right, bend the knee up, good. You're gonna have posterior glides, which I tend to like doing them like this, kind of gliding with the heel in through here. So posterior glide, go ahead, bend it up, good. And then you assist a little bit more, and then go back down a little bit, go back up, good, just like that. And then lastly, there's something called the squeeze technique, and I've ran into people that maybe have some meniscus problems, maybe. You could have some pes anserine like bursitis, so just kind of pain right around here in the joint line. You just take your thumb, side of your thumb, stick it in right through there, right around the joint line, and then you compress it right in. And then you have them bend their knee on top of it, maybe using like a little belt around it so they can give the overpressure on their own. But that'll sometimes reduce the pain in knee flexion and extension too as well. And that's about it for the knee. There's quite a few of them.